So we are on week 3, and no, there is no quiz today. The reason is Monday was Martin Luther King, and we have 5 classes on Monday. So if almost half of the PEDS classes weren't getting the quiz, nobody gets the quiz. So what we've decided is we're going to be giving the quiz before the exam, figuring that you don't mismush things in your head and then try to take the quiz. Let's give you the quiz on school age adolescents first. It's heavier on school age than adolescents, and you're going to see that in today's lecture. Okay. And then we're going to take the exam to follow that. Anybody with accommodations, get with me how you want to do that. You want to come in early, you want to stay late, you want to be in a private room, whatever you want. Please, what are your wants and needs? And I'm going to try to help you do those things. So, Amanda, can you come on camera? I'll check on her. I know what's going on with her. All right, so
I'm
we
trying.
are, thank you, Amanda. I know. Okay, so let's do, let's go first now. And what we're going to do first is we're going to do our PowerPoint, then we're going to do a Kahoots, then we're going to do the rest of the PowerPoint and finish it with the adolescent Kahoot. And even that one's a little shorter on the adolescent. Know that this week you do have NCLEX questions due. Be careful. They're on growth and development. It is not under the pediatrics tab. If you have done the NCLEX questions, you turn them in, you see a 0. I'm not going to give you a 0. Go to the comments and it'll tell you you didn't do growth and development, go back and do it. There's a separate topic with all of the different ones. With PEDS 1, growth development is one. Just do the drop down tab. It's the infants, toddlers, preschool, and school age and adolescents, and that will get you your 50 questions. So let's go ahead and start here with some school age children today. So, school age. Now, you're going to see different ages in reading, but mostly school ages 6 to 12. My dissertation was on school age, and I saw it from 5 to 11, 5 to 13, 6 to whatever, but for us, it's ages 6 to 12. It is the age of all of their baby teeth have come in by that age when they're starting school age, so they've got a full set of teeth, but all of them fall out, and by the end, and they go into the adolescence, they're going to have all their permanent teeth in. So it is a big acquisition of being a baby, getting rid of baby's feet teeth, getting all permanent teeth, and growing up during this time. It is slow and steady, they call the growth. About 2 inches a year. Boys and girls are about the same still. There's not a taller kid. That usually happens almost when it gets into that pre-adolescent growth spurt and 13, 14. I call it the 8th grade. I grow over the summer into ninth grade all the time. I watch. Even all my children and all my friends' kids, right at that summer, all of a sudden you see them spurt up and grow. When the kids are preschoolers and younger, these children tend to be clumsy and they waddle more and they're not as graceful. In school age now, their muscles are becoming stronger and more efficient. They're becoming more graceful and agile. That's why the ballerinas and the taps and all of the sports are a part of it. They know that in the beginning of school age, at age 6, the child still looks like a kid, right? By the time they get all their permanent teeth in, big teeth, right? Now all of a sudden their face changes and now they look like adults. The one thing to be careful with, don't think that just because they are a school age, they're age 8, think that they are, that old. And you've got to be careful looking at the age. I'll give you an example. One of my grandsons, he's 9 years old. He's 5'2", but 145, 150 pounds. The kid looks like a teenager. And when people talk to this kid, they talk to him like he's a teenager. Mentally, he is a very young 9-year-old and needs to be treated that way. And people look at him like he's a big kid. So don't make the mistake. Find out who he's it. You know who the child is. Look at the age, because I'm telling you, sometimes girls look like they're teenagers and they're 8, 9 years old. So that's one thing with pediatrics. As they get older now, all of the body systems are getting more mature. We've gotten all the germs, right? We've gotten all the immunizations. So our immune system is really good now. Um, we're able to go on car trips, except if you're with my daughter, you still can't. Every hour she'll have to stop to urinate, but she's been that forever. But usually children will be able to hold their bladder longer. So it's longer periods of time. It's not like all the time gotta go. And that's now they've been cut, they're potty trained, and now they can hold it even longer. Their bones are getting more ossified. That means they crack and break a little easier. Remember, when they're younger, they tend to be softer. They tend to bounce more, believe it or not. As they get older, no, they crack as they fall. As I just said, physical maturity doesn't mean they are emotionally where they should be. Always be careful. Now, one of the things we see in school age children is these kids, we know they love to please. And if all of a sudden we start to see that to change, they become aggressive, or all of a sudden they're having these tummy aches and they're ouch, and I got to go to the nurse, and you're starting to see a child that you didn't know before. This could be one of the signs of distress or stress of a kid at home. It could be there's abuse at home. There could be maybe the cat died. Maybe mom and dad are getting a divorce, or they are homeless. I mean, there's so many different things it could be. So, as nurses, or if you're a school nurse, this would be something that you would think about. Now, I've mentioned prepubescent, and this is right before you become an adolescent. This is when all of a sudden you start to get the body parts of an older person. A female starts with breast buds. That's the beginning of, their puberty. Males get enlarged testicles. It's just part of the beginning of it all. Now, boys start later than girls. So girls start about age 10. They're starting to get that. And, I always remember at age 10, I was in fifth grade. And I remember having a crush on this guy that was in my class. And he just thought girls were stupid. But looking back, he was 2 years behind with puberty and all of those hormones that go with it. So he wasn't ready for a girl to like him yet, right? At my age. I mean, maybe today, but not back then. So 2 years, boys need to catch up to the girls. So it is age 10 in girls, 12 in boys. Now, assessing a child, again, depends on their developmental age, depends on how old they are. A school age child is age 6 to 12. So if they're 6 years old, you're going to say, we're going to take a picture, and it's a camera. It makes loud clicking noise and it moves and it's big, but I'll show you the picture when you get back to your room. And you do. And I've gotten to the habit. I'll always show a young kid their picture, whether a broken bone, and pneumonia, a constipation, whatever. If I can show them something, I'm going to let them know what they've done, or holding that stool, or where the break is, so they understand the cast and not getting it wet. They understand when they see things. This is school age. When you show them, it's now concrete in their mind. They see it, they understand it, and now they can help take care of themselves. I mean, an older kid, you might say, you're going to go for an x-ray, going to see if your bone is broken. A younger kid, that would be a 6-year-old little boy might think gamma radiation rays are coming out of the machine and going to zap him in the chest, and he's going to die. I mean, there's too many superheroes out there today. So please explain it, because these kids will turn around, run down the hall, out the door, and into the parking lot. And I've seen it more than once. When we're doing the assessment, always know we go from the least intrusive to the most. We're looking first, that's the inspect. Then we can listen, auscultate, percuss, and palpate those areas. I've mentioned it before in my cahoots. I'll mention it again. Lymph nodes are there to make what your body needs when they're fighting an infection. So if there's no infection anywhere, the lymph nodes should not be felt. They shouldn't be anywhere lumpy at all. So lymph nodes, non-palpable if you're healthy. In health assessment, you were taught how to do, your assessment, right? Well, that's head to toe. Remember, children are never ever head to toe. It's when you can, and we'll discuss that more as we keep going. But one of the ways we can figure out the hypoglossal nerve in parts of the assessment is just having that child stick their tongue out. Even infants, you can sit there and they'll imitate you. You go like that, and the infant's going to try to stick their tongue out at you so you know that nerve works. Another thing with children is that there's bronchial sounds and there's breath sounds, and means upper airway oral mucus sounds versus real breath sounds. Make sure that not only listening to the lungs, that we listen to over the trachea at the suprasternal notch. And what that does, it tells us if there's mucus in the upper airway. And it's not the lungs are fine. I'm listening to that, what I thought was bronchi is upper airway mucus. And if we blew our nose or suctioned it out, it would be clear. Okay, the first exam has about 7 different questions on your theorist. So, Freud, again, Freud talks about anything sexual, but when we get to school age, he uses the word latency. What it just means is that at this time, it's an exploration of relationships, but same-sex peers are their friends. He believes that same-sex get together and they help develop each other's thoughts, exchanging feelings, cultures, et cetera, et cetera. That's Freud. Why he says that at this point, this is school age. Now, Erickson, psychosocial. How do children react to people around them? Well, school age children, as I've said, they love to please. They love to be praised of things they do well. So I might be the fastest runner, and people tell me, oh my God, Betty runs the quickest. Or I might be good at math. Nobody could beat me at a math problem, or spelling, or maybe I write the best. There's always something you do well. And what Erickson says, that's a sense of industry. Now, how are you going to remember the word industry? Well, an industry produces a product. It could be a factory, right? A person, a child produces something that they produce, they like, that they produce well, whether it's their running, their math, their spelling, whatever. I feel good because I can do this well. That's my sense of accomplishment. And it makes me feel good because peers are going to tell me, wow, you ran fast. I can't beat you. So that's Erickson's, this side of it, sense of industry. But can you do everything well? I don't run fast. Now, I can run 2 miles, but I've never been able to run fast. So I have a sense of inferiority about that. When I played sports, I had to hit the ball farther in order to get to first base because I was really slow. But again, inferiority is not everything that you can do well. I might be that good runner, but I might, not be good at math, or maybe I'm great at math and bad at science, or whatever. So my industry is what I do well. My sense of inferiority is I'd love to do everything well, and I can't. One thing else Erickson says about school age children, many times we get these kids that'll be prolonged stays in hospitals. Many times they might be in a room and secluded. For instance, what about a bone marrow transplantation? Nobody can stay in the room with them. They're in this isolated room. And when people go in, they are head to toe covered, with head, gear, footies, mask, shield, gloves, the whole bit. So we've got to do things to keep these children mind going instead of just TV or something. So we're going to say, let's give them a challenge. So it might be the kid likes to do puzzles. It might be they like to paint pictures. Whatever it is, give them one of those things, the puzzle or to paint the picture. Don't make it easy, but don't make it that they cannot solve it or do it well. Give these children something that challenges them, but they are able to complete. Because if not, they're going to have that sense of inferiority and they're not going to like it. Okay. You always want to give them industry. And there's a question regarding that sort of stuff on the exam. How do we not frustrate them, but give them what they need? School age children. Now, Piaget, again, is talking about thinking. Remember, they took the rattle and all of a sudden it shook and they liked the noise. I go, oh, now I can shake it every time I get it. And my little 9-month-old little Benjamin is doing that. And then it fell in his mouth and now it's in his mouth and he's sucking on it. And that just came from that reflex grasp and he grabbed the rattle the first time. So we build upon what we're doing. Now, school age children, there's been a lot of learning going on here. Now we're starting to understand relationships between things. And what does that mean? Well, if there's two 8-ounce glasses, one is tall and one is short, a younger kid is going to pick the tall glass has more. The school age child knows they're both 8 ounces, they're the same. The school age child can take their closets and do short sleeve, long sleeve, red shirts, pants, skirts, dresses. They can organize things now. They know, they understand that sort of stuff. And that's that classification things. All of these things in one place, all of these things in another. They're starting to understand all of those things now. This is some examples. It's the glass that I said. Piece of clay that's big, you smush it. The bigger one looks bigger, the one that's smushed down looks smaller, but it's still the same. Pennies, whether they're organized or spread all over, they're still the same amount of pennies. They understand that now. All right. When we talk about children, and we're talking about kids with school-age children, and we're talking about how they understand stuff. School-age children have to have seen it before, which means it's concrete. Remember, concrete, you can see it, touch it, feel it. I've seen it before. They can replicate it, right? When we get into the end of school age, beginning of adolescence, this is formal operations, and they can figure their way out of a paper bag. As in, tell an adolescent or older school age children they can't go to the dance on Friday night because they failed a test. Well, what is that kid going to do to try to get to that dance? Because, their favorite girlfriend's going to be there and their friends are there and, they got to go and they got new shoes and they got to be there. Well, they're going to be doing the dishes, taking out the garbage. They're going to bring you coffee in the morning. Teenage children formally can figure it out. You don't ever have to teach them. They can figure it out systematically. They know what to do. So the difference, concrete, school age, formal, this is all about figuring it out, figuring their way out of a paper bag, and that's your adolescence. Now, morality. I told you, infants and your toddlers, they don't really understand right or wrong yet. As they get up into school age children, they understand reward and punishment. When they get to school age children, they just follow the rules. They just want to please. They are pleasers. They conform to the rules. They understand the rules as they've been taught, not rules they don't know, rules they've been taught. Spirituality and spiritual development, again, it's still very concrete, which means concrete means you have to see it, touch it, feel it, smell it. You have to have seen it before in order to understand it or to be able to do whatever you're talking about, okay? So where do they get this concrete terms? They get it from their families. They get it from their friends and their families and people that surround them, okay? Children want to know about God or whoever that higher power more than they are, okay? They believe if they've done something wrong and they fall down and they break their arm, they feel that because they had done something wrong is why they broke their arm. This is what your school age children do believe. So they punished for that misbehavior. And that's one of the reasons why, I'll teach these children, especially before surgeries. Let's say it's an appendix surgery and the kid looks very concerned and worried. I will tell them, you did nothing wrong for that appendix to go bad. It's just something that happens sometimes. So don't think that you're being punished. And you wouldn't believe how sometimes these children just thank you for telling me that, or you watch their shoulders relax, or they give you a hug, and you're sending them to surgery in a better condition because emotionally they're better. Around people, again, remember same-sex peers are very, very important. Same-sex peers are a lot when we see them in groups, Girl Scouts, Boy Scouts, 4-H, all things, sports things for boys, a lot. And we know that in school age children, they're going to switch sports to be with their friends, their peer, their buddy, the one that they're best friends at this point, because they want to stay together. It's There's no real commitment to one sport or the other there. We know that peers now are another influence on the character of this child for what they're thinking about life, right? Clubs, peer groups, we know all of those things. Remember, now there's another adult in charge of your child, along with teachers now giving their opinions. Again, children are learning about the world and about different sort of peoples. They say school age parents, you want to be their friend, you want to be their buddy and hang out with a kid. But at this point, they still need the child to have a parent, not to be a friend at this point. I think that happens late adolescence, if you're lucky, with your children, so that be able to continue to talk with you. But you also need to be involved so you know what's happening with them. Play. Well, you thought you got rid of play with the younger kids, right? Nope, still going to have play. What does play do, though, for everybody? As a kid, it teaches you rules, rituals, right? It teaches you how to work as a team. And that ego, feeling good about winning, doing something right and winning. They're starting to learn about themselves, what they do well, right? We've talked about that. They're looking what they like about themselves. Do they like their eyelashes, their hair, their feet, whatever? I mean, kids are all different. They like different things. And as I said, other adults now are there sharing experiences and widening that child's, emotional horizon, on children. When we give them those strokes, it leads to really good feeling about self-concept and self-respect and happiness. They're understanding their physical selves as they get older and older. They're starting to say, when they're younger, they don't really understand. They got curly hair or straight hair, or they got a big nose or a little nose or big ears or whatever. They don't. But as they get older, they start to see it and understand it. They do know that hair is always one of the most important thing. And if you got those big blue or big brown eyes, everybody will always remark on those things. School age children are very aware of the differences, whether they had to wear glasses or braces or hearing aids or something different. School ages are aware about it. When school age starts to go into school, we know, that hopefully they've had preschool, they're going in. Again, we're getting the values of all the kids, right? Every child brings in something into that classroom and they're really sharing. And again, peer relationships are extremely important at this point. Promoting health, safety, infection control, health and wellness will always be part of exams. Nutrition, nutrition, nutrition. Now, the type of diet that these kids get, again, should be well rounded. We know school age children are probably one of the best group of children that we can teach. This is where we start teaching them about not doing drugs and not smoking cigarettes, and we can teach them also about nutrition, right? It also, there is this thing on the internet called My Plate, and it's something that the school systems goes over it with them, and it shows them what type of foods they should be eating in every day. And it gives them an idea. It doesn't mean they're not going to get it at home, because we know that healthy foods cost more. Fresh fruits and vegetables cost more than sometimes going through the fast food, right? We know school age children tend to eat a lot more. They're not as picky as the younger kids, but yeah, they've got preferences for sure. And we know that this is the time that we really got to be careful about their weight. Um, the one thing that's happening with school age children is they're not going out after they come home from school like they did many years ago. A lot has to do with the environment, the neighborhoods, and being afraid to have the children out alone in the neighborhood. Also, another thing is children today want to come home, go right on their iPads, computers, and play games and, talk to their friends and buddies and them and whatnot. And what that does, it leads children coming home, having a snack, not moving, sitting there, and now they can become those overweight children. What we have seen, overweight children have an increased risk for adults that have hypertension, diabetes, high cholesterol, because of all of that extra weight on them and all the extra nutrition on it. So they say early that we start preventing obesity is the best. And they say, and it's when you're pregnant with that child, making sure, number one, you're feeding that child good nutrition when you're pregnant, and then afterwards to continue. We know obesity hits all ethnic groups. There's not one African American or Mexican or Russian. No, it is every ethnic group. It's completely the same. We know that we need to target our school age children because they are a great group in helping to prevent them from becoming overweight and then becoming overweight adults. One thing that was mentioned is school age children tend to sit down for dinner and lunch, and there are some parents that will make them finish everything on their plate. They say they're starving kids and wherever, right? The problem with that is, I mean, I understand it. I'm a mother, I'm a grandparent, and all that good stuff. But when you make them finish it all the time, you're setting a precedence for their mind to think, I can never leave a plate empty, because then they're going to feel guilty about it. So what happens? They become adults who constantly finish their plate. And even if they don't want it and they're not hungry. So again, they're becoming children, becoming adults who are going to be obese. Again, health has to do with sleep. School age children do sleep well. The younger kids, like the 6, 7, 8 year olds, are going to fight those bedtime rituals. They're always, I need another kiss. I need a glass of water. I need to go to the bathroom. I mean, it goes on and on. But older kids, they don't resist and they do get enough sleep. As I said, sports and whatnot, they're good. They love competition. They love it. But again, you have to be careful with physical, emotional maturity in competition. You're going to have bullies. You're going to have parents that are really strong. So again, parents need to be involved in that. Um, we know that during being school age children, they're having more interest in cell phones and getting on that media and looking up all that stuff on all of the sites that are out, Instagram and Snapchat, and I have no clue what else is out there. Dental health. We start getting teeth. The first one is 6 months, right? Doesn't mean a baby's going to get it, but they're going to start almost getting it. So by about a year old, we're going to be brushing with just a wet toothbrush, trying to brush those teeth. Yes, we can use fluoride on them. We think that they can floss their teeth. They say that a child who is in first grade, 6 or less, they don't have the dexterity to do the flossing, but the flossing is one of the most important things to do. The one thing about school age children, remember I told you all of their baby teeth are in and they all fall out, and now all the permanent teeth come in. So losing teeth is not a sign of poor dental care, is it? It's because all those baby teeth are coming out. You expect it. Now, if there's pain in the teeth, They can have cavities, yes. So pain is a cavities, but losing his teeth is absolutely normal. What happens, and this happened to me, I can't even tell you how many times, I lost count. Children would fall down on cement or on the side of a table or on the side of a pool is a big one and knock out the complete front tooth. What do you do with that tooth to protect it? Especially if it's one of the permanent teeth, because you want to save it. You want to get it reinserted. Well,
Put it in milk.
you put it in cold milk. Yes. Actually, a student yesterday told me she works in a pediatric ER and she asked the question, why cold milk? And she says the cold shocks the roots so that it's not going to disintegrate. So it freezes them, and then the milk is the calcium for the enamel, and then you get them to the dentist, pediatric dentist, or to an ER as pediatric dentist. They numb it up with a big numbing cream, and then they take their hand and they just shove it in there and put it in, and then they're on a soft diet. I want you to know many of the teeth they stick. Can you imagine what it would cost to put in a whole front tooth, a permanent front tooth in a dentist? So to take it and put it in there and for it to catch, that would be what we would want. School age children are getting more and more curious about sex. Again, the thing is, ask them what they understand first. Don't think they understand the whole thing. All right. And then if they ask questions, you answer them as honestly as you can. Nurses, school nurses, I think these are the nurses that the kids, the older kids, become, quote, friends with and go in and talk. Again, as a nurse, there's difference between sex and sexuality. And again, asking questions before you answer them. And then, of course, this nurse will communicate with the parents if they need to, if something's going on. School nurses are amazing. It's an amazing job. I've always said if you're a young woman who wants to have children, you want to be off every holiday with them, right? Well, you can have summers, you can have, Christmas break off, all of the holidays, a lot of them. And school nursing is actually a great job. Um, it's it can be a lot of work. Now, can you imagine have been a school nurse when COVID came out? COVID is big infection control. This is medical problem. This is a school nurse problem who had to guide with what that whole school was going to do. So school nurses work really hard that way. They also, if they see bacterial meningitises, they will send out notices to parents. Hey, if your child was around this child, please, you need to get a prophylactic antibiotic, and this is what it is, la, la, la. I mean, they do a lot of great things. So injury, and school age children. So what's the most common for any age child? Motor vehicles. From infant to adolescence, the most common cause of severe injury and death is motor vehicles. And as I said, whether you're in the car or ran over by a car. One of our risk factors for children having injuries is that child that's in that stress-free family environment, the one that's starting to act out, the one that's having abdominal pains, and they're not thinking right. So they tend to do things and get injured, and they don't, it's because they're not thinking correctly. They say rear seat for all children until 13 years old. They should be in a booster seat till they're 8. And I live in South Florida. And, Chrome Avenue is not too far away from me and the Everglades. And you're always seeing ATVs running up and down that road and in all the fields, vegetable fields that are out there. And a lot of them are young kids. And it does scare me. The book recommends no children under 16. It's a motorized vehicle. And a lot of times you get out of cell phone you can't talk on them. You have no service at all. So they don't want those kids on them because if they get hurt, they couldn't take care of themselves. Another thing with safety, injury prevention will always be safety equipment for the kids. You know, their bicycle helmets, their knee pads, wrist pads, elbow pads, whatever they need in order to protect themselves. So, school age children, they go into school, they're, 5, 6 years old, and now they're getting all of these other people and telling them what to do and learning all of these cultures. So, parents just need to be there and watch and listen and to be there to catch them if they need help. That's that unobtrusive as you can be. And I know it's hard. ADHD is a big common in children. This is the child who can't focus, who goes from task to task to task. This is a child who can't sit in the classroom. Many a times it gets to the point where the teacher has to get them to the school nurse because the classroom cannot function because these kids are just so disruptive. Now, then it's the school nurse's chore now to try to do something to help this kid understanding why his brain is working at a mile a minute. Okay. One of the things that we assume, and I know this because I had a really dear friend whose son had severe ADHD, and she did everything to try to help this child. And the school just called her in and acted like the kid was spoiled rotten and didn't want to listen. Now, as nurses, we don't want to do something like that. Call the parent in and ask them, so what have you noticed at home and what have you tried to do? And then sit there and be quiet and let them tell you, well, we do this, we do this, we do that, we do that. And now you understand this parents, they're just so frustrated. Together now, make a plan together, okay? Never assume that this kid is not listening and is just spoiled. Enuresis, we're going to talk to about more in week 8, but enuresis is bedtime wetting. Some kids always bedtime wet, and some kids never bedtime wet. Acoparesis is when they children are functionally constipated, but extra stool oozes around and there's soiling that happens. We know this is another week 8 that we're going to go into, but we know constipation, holding the stool, is an emotional problem. Children can do that, they can hold their bowels. So a child has an avulsed, knocked out tooth. The parents are reluctant to try to reimplant the tooth. Where should the tooth be placed for transport? So where do you put a tooth that knocks
A.
out? We put it in cold milk. Yes, we do. All right, who wants to win the cahoots today? Anybody? I know it's Friday. I know you're tired. Remember, I don't go back. I don't look at these scores and who did what. This is here for you. This is your test of, do I understand the concepts that have been going over? All right, let's go. Week 3 already, guys. School age. According to Kohlberg's pre-conventional level of moral development, a preschooler has moral reasoning what? What do preschoolers understand about moral development? So infants and toddlers really don't understand that right or wrong yet. It's that preschoolers who understand reward and punishment. So that is, the actions are either good or bad, and there's a good consequence, and there is that bad consequence, okay? As we get to be school age, that is when we follow the rules and we try to please, okay? Preschoolers do right and wrong, and they just know it at this point. In which stage, Erickson stages, do children begin to understand conservation? So let's look at the words here. There are Piaget words here, and then there's also Erickson's words here. Which is which? So conservation is understanding that 8-ounce glass, okay? It's still the same. And remember, school age children are the conservation. And remember, school age children have to see it, touch it, feel it to know it. Remember, that's concrete. I've got to see it. I can touch that concrete. And remember, formal is they figure it out by themselves. They just do it. They don't have to understand it and they don't have to see it. According to Erickson, industry versus inferiority begins at what age? Well, industry versus inferiority is the school age according to Erickson, and that is ages 6 to 12. That was a question, don't overthink it. It's what is industry versus inferiority? It's my industry, what I do well and what I can't. That's the school age children, ages 6 to 12. A multi. Erickson, industry versus inferiority. So Erickson, industry versus inferiority is school age. Okay. And it says that I'm good at what I do. I feel confident. Okay. It's also, I feel good at what I can do and I feel good with it. And we know that inferiority is, I just can't do it all well and I just do want to, which is a common sign of stress in school age children. So one of the things you might see is that stomach pains. Another thing you might see is they become aggressive. They're just changing their whole mental status. They're not that kid that was good who comes to school, who's good at school. All of a sudden, you're seeing changes. It's a big red flag. A multi. What are signs of stress in school age children that need to be investigated? So, school age children that are starting to bedwet, there's a problem. Is it emotional or is it diabetes insipidus, diabetes mellitus? Is it a urinary tract infection? It must be investigated. Also, regressing to an earlier behavior. That means there's stress. Something's going on and it needs to be why? What's going on? What can I do to help you? Very good. A multi. Safety education for the school age child might include Remember, school-age children are the best group of children for teaching. I mean, part of my PhD dissertation was all school-age children, and I learned that, we're missing the boat if we're not teaching these kids because they do want to please and they do want to learn. So, safety education for everything. It's the bicycle, the water, the motor vehicle, firearms, all of it. Anything we can do for these children at that age, yes. Dental care typically begins about what age? So I'll say, when are you going to get teeth, right? You have to have teeth to have dental care. So birth, that's out of it. So about 1 year old, you'll start to see the teeth coming in, and it's just to keep them from having cavities. I'm going to share a personal story. My firstborn, he's now 42. This boy at birth, there was no things as a sippy cup back then. And he liked to have apple juice. And I put it in a bottle, a big bottle with a plastic nipple on the top. And he would put it in his mouth and carry it around all day long. All of his teeth turned that black bottle rot as a young child. Of course, my second kid, it didn't happen to, but it does. It can happen that quick. And even me, who I should have known better, I didn't. According to Erickson, trust is to blank as identity is to blank. So, what are the Erickson's levels here? Do you know them? You need to know the names. Well, first of all, we know trust is an infant. I trust, I cry, you coming to get me. Identity is, who am I? What am I going to be when I grow up? And that's an adolescent. That's how you have to remember that one. And you can see identity versus role confusion. What am I going to be? A doctor, a lawyer, an Indian chief, right? So again, remember those names. How does the onset of pubertal growth spurt compare in girls and boys? So we know it's 2 years before girls, and then 2 year later are boys. That's why young girls, they think all the boys are being acting stupid because they don't want to be with girls yet. What age appropriate activity should be included in the teaching for a 6 year old child? Age appropriate. Remember, school age children, you want to challenge to do something, but you don't want to make it so they can't compete and finish it. You understand? This is too hard. I can't now. I'm frustrated. What can I do? Maybe a little help. So I'm going to be able to jump a rope. All right. Solving a large jigsaw puzzle, that's not going to give any challenge, right? Playing hopscotch, maybe, maybe not, I would say with that. And competitive sports, they actually say they shouldn't be in competitive sports till a little bit later because emotionally they can't handle the stress of it. I mean, if you have a parent there for all the practices and whatnot, that would be something different. But competitive sports, they might get frustrated with it. How is chickenpox spread? Varicella. You're going to say there's an immunization for it. We don't have chickenpox. And the answer is people still get chickenpox with the immunization. I've seen it over and over again. Now, chickenpox, the problem is it's airborne. So I was a triage nurse in an ER for the last 10 years of my career. And the one thing I had to be concerned about is placement of patients, keeping me safe and everybody else and that child safe, right? One of the things, chickenpox, the way that they present, high fevers, 101 fever, macules and papules at all different stages of healing and itching. They're pruritic, they call it. When you get a child, high fever and a rash that looks like that, immediately I put an N95 mask on me and get that child in an airflow room so that they're not spreading chicken pox. You have an immunosuppressed child that has, leukemia, you could really seriously harm them. So again, chicken pox, it's this benign thing, right? But not for everybody. When can you send your child back to school when they've had chicken pox? No fever, and the chicken pox are all dried up because it comes out the oozing of all those macules and papules. Multi. At what point is a child with chicken pox not considered contagious? So they're going to itch for a while because remember, they're still, drying up and they're still healing, and healing wounds do itch. But no new eruptions, no fever, and the lesions are crusted over. They can go back to school. They are contagious before they break out with a rash. So you don't even know when not to be there. Which age group characteristically plays with the same sex peers? So, same sex peers, this is your school age children, okay? Culturally competent care includes. So, when we have a patient that's not of our culture, I have come from a small town where I didn't know many cultures at all. And I came to Miami, whatever years ago, a long time ago. And I've got all of these cultures, and I had to learn how to take care of them. Number one, I have learned if I don't know, I'm going to ask either the parent or if it's an older child, if there's anything I need to know, any special diet, any special prayer things, any special anything that they need. Sometimes it's they only want females to take care of their female daughter. There's a bunch of different things. Now, if it has to do with prayers and all of these things that they need to do, absolutely. You can infuse that into the care as long as it doesn't affect your medical care. Absolutely. I've done some crazy things, but all the things that I've done has given those families what they needed for their own culture, and it didn't affect their care. Flossing daily is recommended for good dental health. Yes or no? Absolutely. Good job. A 6-year old needs to get a chest x ray. What explanation is best? So again, 6-year old, it's more get on their developmental level. It's a big picture. We're going to look inside of you. Is it not going to hurt? They're not going to listen to that. An X-ray they don't understand. And I think the fourth one there, even adolescents are going to take show you lungs of any consolidation. They're going to say, what does that mean, right? Care for a knocked out tooth. What do you do? My tooth came out. I mean, we've already decided that the first thing that it will need to be is that it has to be cold milk. If there's no cold milk there, the second best thing is saline. At least get it into some cold saline to get them where they need to do. That's an isotonic solution for it. They also say don't touch the root, only touch the enamel tip of the tooth because you don't want to damage that root at all. Which thought process involves logical thinking for school-age children based on the developmental theorists? How do school-age children think? School-age children think if they've seen it, touched it, felt it before, they can do it again. That's concrete, okay? Yes, they are a stage of industry. They do things well, but it's not the way they think. This is the way they act to people around them. That's psychosocial. And then formal operations is your adolescence. They can figure it out themselves. A multi. Erickson's school age. Which ones? Let's put it all in one slide, right? A little bit of everything. We know it's the industry versus inferiority. We know the industry is what they do well. Inferiority is when they can't do it well. We know it's that accomplishment they like and they need to be challenged with tasks, but that they still can complete, okay? And we know that they should be taught, not everyone will able to do everything, but they're still going to get the sense of inferiority because they still want to. According to Kohlberg's conventional morality, school-age children believe what? What's the morals on Kohlberg? What do they believe? Infants and toddlers don't have morality. Preschoolers believe in that reward and punishment. What do school-age children believe? They believe they're going to follow the rules. It's the right thing to do. They conform to society, is basically it. Whatever should be done is what they want to do. They're pleasers and pleasers, school age. Anorexia nervosa. I've put two eating disorders here to mention them to tell you what they are. I don't have them on one of the slides. Just needs to tell you what does it mean. So usually when you think of an eating disorder, you think of anorexia nervosa. This is when they eat a piece of lettuce and a glass of water and they think they've eaten too much calories, and then they ride on their stationary bike for the next 6 hours to burn off those 2 calories. It's they get so skinny because they just restrict everything from them. Which signs may indicate that someone is struggling with bulimia? Now, anorexia nervosa, they don't eat. Bulimia, they eat large portions of food, but as they're eating, they're vomiting it. This is that child who finishes eating supper, dinner, gets up and runs to the bathroom and purges immediately. That's what they do. Now, one of the things that you do see with bulimia and not anorexia nervosa is their teeth are going to start burning because of the stomach acid, because of all of the vomiting they're doing. And sometimes it's the only way you can figure out what's the difference. Which of the following could be a sign of potential child abuse or neglect? So, children that have these unexplained injuries or bruises, or the story doesn't match the injury, this is the big red alert. Remember, when it comes to child abuse, nurses, our responsibility is to keep children safe. And if we think something's going on, we need to get the proper authorities called in. I've got two cases that I'll never forget in my life, and I looked at both and I suspected something, and we did call in the authorities. One was a starvation thing where this boy was probably about 60 pounds, and I think he was 9 years old. He was strapped to a bed, and they didn't feed him. Came into the ER and it basically took his last breath and coded. We did resuscitate him. He needed intraosseouses. We couldn't find a vein on him. There was no fluid in him barely because he wasn't no liquids, no food at all. I want you to know a month later, we revived him. The kid did come back a month later. The supervisor brought him down to tell us all thank you. Now, it was a parental thing that was going on. That child no longer lives with that family or involved with them at all. But that is, the clear sense of what abuse is. That's one of them. Cooperative play. Which one is that? So cooperative play is school age. This is two or more children working together, but there is a goal. They build a sandcastle, they build a house, they build a race car set, they play checkers, somebody wins. That is cooperative play. Remember those different plays. Remember, toddler is parallel play. Next to each other, they're not sharing me, mine. Okay, that's parallel play. Toddlers. Preschoolers are associative play. They're all playing the same toys all together, but there's nothing that they make. There's no goal. School age children, cooperative play. Two or more kids playing together and they build something, they make something, or somebody wins the game. What type of play is considered cooperative play? So, checkers, absolutely. Sharing toys is still an associative play, okay? That doesn't, there, what's the goal? What did they create? Who won the game, okay? Checkers, somebody wins. What two sign symptoms can be found in children that have ADHD? So ADHD, it's that constant agitation. They're interrupting. They can't focus. They don't finish. They go from task to task to task. And these children are very frustrated. It can require, some psychiatric help, but also could be involved with medications too, or a combination of both, depending on what that child needs. All right, let's see who did this one. School age. Number 3, we got an H. Good job, H. And an IH, number 2. And number 1, drum roll, please. Bing, an AG. Good job, AG. Good job. And an MM and a jazzercise. Okay. All right, we're going to go to your adolescents. And we'll go from there. Any questions anymore? Okay, so now let's go into adolescence. This is ages 12, and most pediatric hospitals go up to like age 21. So, what are adolescents? Now we were school-age children, treated like kids. Now we're becoming adolescents and becoming adults. It's this major confusion going on here. It is a rapid physical, cognitive, social, emotional maturation. It means they have to grow up. They have to, figure out what they're going to be doing in their lives, okay? We know that the beginning of adolescence starts out with the beginning. We start to see those secondary sex characteristics. And then we know about 18 to 20, somewhere around there, they're done with their final growth, and that's the end of their growth. Now, their development. Now, we know that boys and girls have body parts, for reproduction. We also know that we have secondary sex characteristics that go along with the menstruation and growing up to be mature adults, right? That's the hormone, the voice, the hair, the breast, and the fats, and all that sort of stuff. Now, boys' first change is testicular enlargement. Girls are all of a sudden, you see those little breast buds. They do say once we start seeing these changes that a girl after about 2 years later are going to start that menstruation and puberty, okay? It's also said boys and girls about age 12 should start that 3-dose series for the HPV. Now, this is Tanner's stage. Now, it's a big stage, it's a lot of information. I want you to know I saw Tanner's stage on a HESI where it was asking what stage the child was in. So I said to myself, can I make this that you all will take this big, thing and figure it out easier? So this is what I've done. Stage 1, they're still babies. There's no growing up done yet. Stage 5, they're completely grown up, all right? Full body parts are all there. Stage 2 is that first thing that happens. Girls get the breast buds, boys, testiculars, their testicles get enlarged. So there's only 2 stages left, 3 and 4. So one has to do with hair coming up, and the other one has to do with a menarche. It'd be a 50-50 chance to get the right question at this point, wouldn't it be? I'll send you this for you to have to take a peek before you do your essay. So adolescents, their physical growth. So they've, gone through their school age and growing that 2 inches a year about. And then all of a sudden, they do this spurt, this growth spurt. 20 to 25% of their total height is achieved during puberty. It happens over about 2 to 3 years. So all of a sudden, I've seen in 8th grade kids be so short when they get out. And then over the summer, all of a sudden you see them grown, and slendering out because now they've grown those 6 inches over the summer, it seems. And that's that pre puberty growth that's going on, prepubescent growth spurt. We know that this happens with both kids, boys and girls. Now, let's go into the theorist again. Let's talk about Erikson, which means how do people, talk or work with the people around them? They're psychosocial. The people around them, how do they deal with them? Well, when you talk about Erikson, it's about the identity. Who am I? It has to do with I have too many acne. My hair is too curly. It's too red. It's too brassy. I don't like my nose. I'm too fat. I'm too skinny. It's my identity, what I look like, because they're trying to fit into groups, right? So their identity has to fit into what they want to be when they're what group they're going to be in. So it's the identity versus role diffusion. Okay, so this is what I look like. I've got to figure that out, and now I got to figure out what I want to be when I grow up. Know that children, adolescents, older school age, young adolescents, because of all of these changes and their identity they don't like, they can become severely depressed. one of the things they say with adolescents is if they start, having these changes of depression, as in they're sleeping too much or not enough, or eating too much or not enough, or not going out like they used to, or start talking about death, take it seriously. These children will commit suicide. It's the second that's up on the list after motor vehicles, okay? So adolescents love to be out and they love to be social. We know that it is this intense sociability, intense loneliness. We know they're out with their buddies and them, and then somebody gets a fight, and then everybody's angry at everybody, and now they're alone and nobody's going nowhere. And now they're, the parents have them at home because everybody's upset with each other. Because, the one thing that adolescents do want is that acceptance by peers, and they want their body image, their identity, they want to like it. Parents are pretty hard on adolescents at this age. We know that parents still want them to have responsibilities and to follow the rules, and adolescents think that they have they want all these privileges. They just feel that they're owed them. And it's just this turmoil that goes on. You can see it, especially the major conflicts over independence and control, over responsibilities and their relationship with their parents. It's about 15 to 17. It's the middle of adolescence where they're like, all of a sudden they've gotten taller, their voice is deeper, the boys, they're getting hair on their chins, they're looking more grown up. They want to be treated like adults, but they're not there yet emotionally. And it creates all of this turmoil. We know that children generally they love to be around their peers, their buddies in them. As I used to tell my kids, oh, your buddies in them are coming over again. Okay, I prefer them at my house instead of you somewhere else. We know that these peers are very, very important, and belonging in groups makes them that sense of feeling of strength and power and feeling good, right? They want that. This is their other world, out of their house, out of their family. They say that the best friend, the way that you treat them as an adolescent, is the way that you're going to be treating your partner for life. So if you're good to your best friends, your partner for life is also going to be treated well. Trying to work with adolescents, we think that it was harder with toddlers and preschoolers, right? I think adolescents are just as difficult. Many of them shut down. They don't want to talk to you. You're an adult, you're authority, and they don't want to talk and tell you things. So we have to build up some rapport somehow. So, things that I would do, and they do work. If I see a teen coming in and they've got earbuds in and listening to music, I'm going to ask them, so who do you like to listen to? Maybe I know the band. They're going to be surprised how much music I know. Or maybe they have a sports t-shirt or a baseball hat on. I'm going to mention them. Trying to break the ice. Or talking about, so have you decided a college yet? Or do you play any sports if they look like they might? Let's break the ice down a little bit. Another thing that I have done is I have seen, in the last several years of working in the ER, you'll have a male or a female come in dressing of the opposite of what their sex is, quote, supposed to be. And what I have learned is this. I'll always ask them, so what do you want me to call you? There might be a name like their name is Rachel, and they may want to be called Ray. That's happened to me before. And again, if you do that, what have you done? You've built up some confidence there because you recognize their difference, but you've respected it, and now you'll call them Ray, okay? That does work. Another thing that we do as nurses is that if there's something that could be related to sexual activity. For instance, the big one that I used to see is urinary tract infections. Girls, would be coming in repeatedly, and how are we going to help these girls if they're not telling us they're sexually active, right? We just keep giving them the antibiotics for the infection, and they come back, 3, 4 months later, have another one. So what we do is we have the parent leave the room. And yes, we can do that. And then because now I've already built up that rapport, now this girl might be more willing to talk to me. So now that girl and me were talk, and she might say, "Yeah, we've been having sex." Or they might tell me things that's going to shock me. Don't be surprised. They're going to try to shock you. I always try to maintain without my jaw dropping in the room with them. It's later on. But you might also be able to say, okay, do you realize that right after sex, if you urinate, you can decrease the incidence of urinary tract infections? It helps that. So you might try that. And just that little hint might prevent another urinary tract infection. But adolescents are really hard to get with. But know that you can get them alone to try to get that private information from them. Because I know I wouldn't talk in front of my mother about sex as a teenager. I didn't do that as a teenager. It wasn't me. As I said, that immunization, the HPV series is a 3-shot series. Nutrition and adolescents. Remember, they're going through that growth spurt. And now, what do they do for nutrition? They grab a bottle of water and they get a power bar and then they get the $5 for mom and for lunch and they go out. They put the $5 in their pocket because they need that for this weekend for whatever they want to do, their buddies, right? And they have water and a power bar and they're not eating properly. One of the things with adolescents is a lot of them are underweight or they're overweight. So, how do you start figuring out what to do for any child that's having a weight issue? Too much, too little. Well, the first thing is to get a diary. What did they eat today? What did they eat yesterday? Food diaries will always be your number one answer when you're talking about nutrition. If there's a problem with nutrition, what did you eat yesterday? Sleep and rest, they should get a lot, but they're not because adolescents are busy. They're on their phone. They are doing a paper for school. They're talking to their boyfriend, texting all night long. I mean, this is what they do. They tend not to exercise as well as they should. A lot of times they'll forget to brush their teeth. We have to remind them. We know that there are influences all over the place, especially for your teenagers. Media is the big one, and we know the problem with that is not all the information is accurate and correct. And they take the information off these websites, etc., as being real and true, and that could actually harm them sometimes. We know that information, and especially as a nurse, or even as a parent, where would you want the information to come from? We've got us parents that we can talk to. School nurses will always be number two, and Planned Parenthood if we still have it around, right? Safety promotion and injury prevention. Number one, injury, all age children, motor vehicles. In children, it goes to suicide, firearms, sports injuries. These kids are trying to get those school scholarships and they're not stretching and they're hurting themselves. It's just part of it. So, Matt, 14 years old, seems to be always eating, although his weight is appropriate for his height. The best explanation for this is what? What happens at that early adolescent stage? Remember that you do that 20 to 25% of their body weight is gained during that time because they're growing so much. So it is absolutely normal because he's getting bigger and taller because of the increased body mass is A. All right, let's go for another go. Let's take a quick 10-minute. Can we do that, guys? Quick 10 minutes. So it is come back at 3:30. We're going to do it quick. Okay, I feel better. I had a little grandson I had to go give a hug kiss to. Let's go with our school age cahoots now. Anybody want to win? Okay, Karina. Come in, Kalia. You need to give me a little bit of I could do this. You too, Aaron? Yes? Maybe? Come on. Here we are. All right, let's get going. Erickson's identity versus role confusion. I think you've noticed on both of these, I'm hitting you pretty hard on the theorists. These are the ones you've got to know. So, identity is always the adolescent. Who am I? I don't look good. I don't like my pimples. And then role confusion. Am I going to be a nurse when I grow up? A doctor, a lawyer, an Indian chief? This is all adolescence. Don't forget those words. This is when adolescents need to establish their own identity and to form values to live by. So, what are adolescents? It's talking identity again here. So, I mean, sometimes the questions seem like, gee, it makes no sense, but it's exactly that. It was that easy. Remember, it's identity versus role confusion. This is all about adolescents because they don't like what they look like and they don't know what they're going to be when they grow up. And that's what what Erickson says. In the identity versus role confusion stage, adolescents So, adolescents in this identity versus role confusion are looking for who am I and what am I going to be? I think I've explained that enough. You can't miss that one now. At what age do you have to be to drive an ATV? To drive an ATV, you must be 16. Okay, 16 is the lowest age. It's not a licensed thing, it's off road, but they say they don't want anyone younger than that because they're not old enough to handle the, responsibility of it. So 16 is ATVs. Since surviving a sexual assault, she startles easily, feels numb emotionally, and has flashbacks. Her symptoms resemble what? This is probably a PTSD that's going on there, right? Post traumatic stress disorder. The one thing I'm going to tell you about sexual assaults and then these children coming in, male or female, it doesn't matter, it's both. That as a nurse, what do we do to take care of them? Number one, it's just not that child that comes in. Remember, they had a parent or a caregiver, a guardian. Somebody came with them, and I'm sure they're going through that same stress, trying to be that big person and hold on. Remember, they need help too, okay? Many victims experience emotional and blank reactions from rape and sexual assault. So again, it's emotional, it's psychological. I mean, it's a thing that will never leave this person. And again, make sure they get set up for help and also the parent who ever brought them in for help also. Which of the following are false about the HPV vaccine? So it's a 2 to 3 injection. It's not what it is. It's sometimes they do three on them. It's 6 months apart, and it's that 12-year-old. It's boys and it's girls. At what age should a parent expect to have major conflicts over independence and control with their child? When I had my kids, they were both teenagers. I was a single parent at the time, and my boy was older than my girl, 17 months apart. And it was difficult holding on. As I always say, having a single parent with teenagers, it's like having a roller coaster. Just hold on tight and just love them hard. It is that middle age again, 15 to 17. They look older. They want to be treated as adults. They don't want the responsibility of their adults, but they just want to have all the privileges to go out and do what they want to do. What Tanner stage marks the onset of puberty in most males? So remember, Tanner has 5 different stages. One, it means they're not mature at all, and 5, they're completely mature and grown up. The initial stage in males is when stage 2 is when the scrotum gets enlarged. Remember, I said the only 2 that you've got to figure out what would be an answer to a question is 3 and 4, because 1 is nothing, 2 is the scrotal enlargement, and 5 is they're completely grown. What marks the onset of puberty in girls? So, onset of puberty in girls, what marks the onset? It's that menarche that just starts there, okay? That's puberty. And we talk about the beginning of going through puberty, it's that beginning of the breast buds. But then we get to the puberty, now we've had the menarche, which is usually 2 years after the start. What is the Tanner scale used for? I just showed you one, talked about it. What is it? As I said, there was a question off your HESI regarding Tanner scale. That's why I went into it pretty deeply for you. So it's just about measuring kids growing into adults and the body changes that occur. It's measuring puberty and sexual maturation. Major causes of death and injury in adolescence is in all age children, motor vehicles, automobiles, very good. True or false? Sex education for adolescents aims to provide information to adolescents about issues related to sex. Absolutely. How can you get an adolescent to be more receptive to talking about their health and sexual exploration? So I know that as an adolescent, a teenager, I would never talk to my parents about anything that had anything to do with sex, because my mother would put me in a room and lock me there forever. So when I really need to speak to an adolescent regarding things that could be involving sex, having the parent leave the room, I know that will make that child feel more comfortable. Also, it's just not them leaving the room, it's letting them know through just silence and listening and understanding that you're listening to them, okay? And that child can talk to you about anything. There could be stuff going on that really needs to be investigated further. Keeping a food diary is the first step of treatment for an obese child. When we're talking about a child who's obese, that somebody's overweight, yes, the first thing we're going to do, we've determined they're overweight. The thing is to find out why, how. And children, what we do is we eat. That's what makes us overweight or underweight. So that food diary will always be your answer when it comes to treatment for obesity, and monitoring it. It's going to be food diary. And last question. An adolescent has been brought into the ER with a drug overdose. What are the initial questions you need to ask? Do you have an adolescent who's had a drug OD? What do you need to know? You need to treat this child. They have an overdose. So we need to know certain things in order to treat them properly. Number one, I need to know what they took and how did they take it and when did they take it. How do they take it will make a difference. If they took it orally, it's going to take longer to be in their system. If they did it IV or nasally, it's going to be going away quicker. So I have to look at the how long is that drug going to be in that body, and of course what type and when. You don't talk about rehab with a drug overdose at that time. That's when you get them stable first, and then later we worry about getting them into rehab and help. Number three, IH. Good job, IH. Number two, Aaron. Good job, Aaron. Whoop, whoop, whoop. You have to smile. And AG. Good job, guys. And an H and an MM. I got a little bit of everybody today. All right, we still have a little bit of time today. I can't let you out quite yet. We could do one of two things. We can do a quick exam review, or I can go over math. What would you all like? We've got
I'd rather
about
an exam review.
25 minutes. All right, that's what I'm seeing. Let me pull it up.
Exam.
Now, on the exam, do you want me to go more into the types of kids? Do you want me to go heavy more on the theorists? What do you want me to go better on?
Theorists. I'm kind of struggling there.
Theorists.
All right, I get you. I totally get you. Right, so exam. Now you all have this in your announcements, okay? It's also posted also under the recordings that are coming in. You always will have it attached there somewhere. So let's look at the dearest. They start this whole thing, so it's really easy. So Erickson. Erickson talks about what? Now, this is the most tested of all your theorists right here. Erickson. They love trust versus mistrust. So let's explain them a little bit again to you. And this is still being recorded. You can go back and listen to it. So, infants, what do they know? They know the people around them. They have to trust them. Remember, psychosocial, the people around them, and how do they respond and work with them. So when they trust, that means they cry or they kick the bed, they make noise, whatever they do, somebody goes in and checks them, changes them, feeds them, burps them, and they're happy. That's trust. Now, what would mistrust be? Mistrust could probably be in a situation, a household that maybe is drug abuse, alcohol abuse, or something's going on where the child, that infant, is crying all the time and nobody picks them up for any reason, hardly ever. Now, you could be trust and one time you forget to pick them up or something happens, but mistrust is most of the time they're not being picked up. This is a child who mistrusts, and that's the sort of environment you'll see that in. When we talk about toddlers, what do we say all the time? Automatically me, mine, right? So I want to be independent. I want to do it, and I'm going to explore the world, right? But then there's that helicopter nana, right? Helicopter mom saying, be careful, don't do that. Let me put your shoe on. Let me pull that up. Let me help you. Which that causes the shame and the doubt because they don't think they can do it because somebody's always doing it for them. So toddlers automatically me, mine. I'm going to do it because I want to. I like independent, but shame and doubt. You're always helping me. You're always telling me be careful. And come on, let me try to do this. That's toddlers. Initiative versus guilt. This is your preschoolers, probably the least tested of all of them, okay? But it just talks about they have the initiative to try to help, to try to do and be part of the family. Let me empty the table, let me put it in the garbage, let me stuff things. But then they drop something, break something, spill something, and now they feel, oh, I shouldn't have done that, and they feel guilty. That's just initiative versus guilt. When we get up to your school age children, we're talking about industry versus inferiority, okay? Now, my industry, remember, industry is my factory. This is what I do well, okay? This is what I produce. Whether I can run fast, and I get all the praise from that. People are always telling me, ooh, you're fast. Or I do math well. That's my industry, my product. And that inferiority is I can't do everything well. And I would really love to, but I can't. Remember Erickson, and one of the ways that he uses this on the exam is talking about giving children a chore to do, but making it impossible to complete would be against what Erickson says. Erickson says give them something that they can be challenged by, but something that you know with effort they can complete. You don't want them to feel inferior. Okay. And then we talk about your adolescence, and we talk Erickson again. It's all about the people around them, their identity, what they look like to other people. And the identity is physical and being part of groups, okay? Confusion is what? Role confusion, okay? Role confusion, which means, am I going to be a nurse? Am I going to be a doctor, a lawyer, an Indian chief? What am I going to be? I don't know. So that's Erickson, all right? Now, Freud. Freud is everything sexual. So the young kids are all about exploring the world in their mouth. Toddlers are anal. They're potty training. And remember, bowels are trained before bladder. Then we get to your preschoolers, the phallic stage. It talks about boys like their mommies better and girls like their daddies better. It's just part of that. Latency, that weird word, latency. And I don't know how to put it into this jingle lingo for you to remember. It's all about, Freud says, as a school age child, you are going to be around same sex peers because there's no threat. You're sharing stories, sharing families. That's what he says. And then we get to the adolescence, and now we're talking about genitals. Now we're getting this attraction to the opposite or same sex or whatever sex you want to be with. You're getting attracted by somebody, and that's that genital stage. Kohlberg. Kohlberg is all about morals, right? Your morals. Infant toddlers really don't have them. But we get to preschoolers. Now, preschoolers understand punishment and reward. They understand if they do something bad's going to happen to them. They're going to get punished. And they know if they do something good, they're going to get a reward for that somehow. All right? That's what they get. When we get up to school age children, we're talking about morals. Their morals are they just want to please everybody. They're loyal. They don't want to be in trouble. They're just loyal. And then when it gets a little bit higher up into the adolescence and morals, it's not talking about personal things. It's talking about societal things. It's like when you get to a red light, you stop at it, right? That's the society law. You get to a stop sign, you stop, or you turn on your blinker, or you open the door for, an older man in front of you. Here, get in for me. It's those rules of society that you just do because that's what you're supposed to do. Adolescents do that. That's post-conventional. I mentioned Fowler's only because it has to do with religion. And remember, there's all sorts of religion and beliefs. You don't have to believe or agree with any of them at all. You only need to know by examining you first. Know what your spirituality, your beliefs are, but give that person, that family, the opportunity to practice their own. You don't have to believe it, as long as it doesn't interfere with medical care. Okay? That's what that slide's there for. All right, Piaget. Now, Piaget is, I think, the words pre-operational and concrete operational. Those things sort of get us a little bit confused. Now, think about Piaget as a thinker. And remember, babies are born, they know nothing. They don't even know how to breathe. We spank them on their butt, right? And they take a breath and they start breathing. That's how they learn. The next thing we do is what? We stick something in their mouth, a pacifier or a breast or a bottle, and we tell them to drink. Now they're sucking, swallowing, and breathing. They had to learn all of that. So these primary circular reactions are the sensory or motor. That first 2 years of life is all about figuring out about things and how they work. So if we were pre-operational, we're figuring everything out, right? As we get a little bit older and we get to that pre-operational or preschoolers, now we're taking things and playing with them. So we've learned them what they are and we've played with them before, but now we're making the little blocks into a car and a broom into a horsey and my arms, and now I'm a little airplane flying around. That's what that means. Now, Piaget, as a school age child and thinking, says they cannot do something they have not seen it, felt it, touched it before, because it has to be concrete in their mind. Remember, concrete, touch it, feel it, smell it, you know it. They can redo it. That's school age children. Formal operation is that child who's an adolescent and they formally figure it out all by themselves. They never have to see it before because they're old enough now to critically think. Okay, does that help you with your theorists? There's a bunch of pictures here to, try to figure out some of them. One of the other professors put it in there and I liked it, so I left it. All right, we'll go a little bit further. We got about another 15 minutes, so I'll keep going. Play. Play is something that is important with children because, again, how does Piaget say that we learn? And it's through building these little things and on top of each other. We learn to breathe, and then we learn to breathe and swallow. Then we learn to breathe and suck and swallow. And then we took a toy and then we got it moving and we made noise. And that's what we do. That's Piaget, right? Now, onlooker is when kids just look at each other and play. Solitary, you're alone. And the next three you have to know. Parallel play is your toddlers. They don't share. They play parallel to each other. Two or more kids playing next to each other. They're not talking, not playing together. They're not sharing. They're playing their own. Me, mine, mine, mine. That's your toddler. When we get into the preschoolers, we're in this big group of kids, all of these toys, and they're all playing with all the toys, but nobody's working together and nobody's building anything, and nothing is going to be finished in the end. There's no goal. They don't build it. That's associative. And then cooperative is school age. And that's two or more children playing together, but they're making something, or somebody's going to win. There is an ending to the game that they're playing, whether it's checkers, whether it's chess, whether it's playing Scrabble, whatever it is, there's an ending to the game, and that's cooperative. Cultural differences, we've talked a little bit about it today, or a little bit again. Remember, about culture is making sure if you don't understand a culture that you find out from the parent or an older child. Be fine. It could be something that has to do with the type of foods they want to eat. It could be that some of them only want female caregivers and no males with their daughter, and that can happen, and I've seen it happen before. Sometimes it has to do with body and privacy, not uncovering them. Only pieces as you are examining them do it. And again, always with culture, you don't have to accept or understand or believe what that family believes in. Again, examine your own, know yourself. That's it. Assessments, make sure you're on the same level. Make sure you're on their developmental level as we approach these children. If an infant is asleep on a parent's lap or there, I want you to listen to the heart and lungs. This is the best time to listen to heart and lung sounds when you're listening to a baby. If not, they're wiggling and making noise and cooing and you can't hear a thing. Always with young children, you go from least to most invasive. I always do the blood pressure last. That big squeeze they don't like, okay? When you're taking histories from a child and a parent, let's say there's an injury and you have a suspicion, and you see that there are different stories, know that this could be a potential child abuse and making sure that that child in your care gets the proper care that he does need, okay? Any child that comes in with sexual abuse or something that's been going on, remember also the caregiver also needs to have a part of the care of the child, that they do need to be considered because emotionally they're going through craziness too, aren't they? And remember mush housing syndrome. Mush housing syndrome is when you're trying to get that baby sick, that child sick, keeping them sick. And, you know, you don't want, they're putting urine in IVs and putting stool in wounds, and they do all sorts of crazy things. With mush housing, remember, the parent, when they're in the room, the one suspected of it, when they're in the room, you must have somebody in the room with them. They don't have to be in the room all the time, but when the parent is there, and to inspect anything that they bring in, okay? So growth at any age, nutrition, nutrition, nutrition. Remember, they double their weight at 6 months, they triple it at 1 year. If there's any negotiation with that, too high, too low, what do we do first? Find out what they've been eating. We do that 24-hour diary. The weight's too low, we increase calories. If it's too much, we decrease calories. And it works just like that. You don't have to know this formula, BMI, okay? What you need to know is that we do look at it and we look at the fat content or that, you know, their body mass index. If it's 85%, they consider that a risk for overweight. If it's 95%, they consider that obese. And again, whenever you're looking for nutrition, always think food diary. Developmental assessments, we do them because we want to find out what's going on quicker so we can correct it with early intervention. And there's all sorts of programs out there today. Know that assessing the heart, this is where their valves are. It's a good review because next semester in capstone, you're going to have to do this as part of your pass off in your sim lab. One of the things that I put down here is the fourth intercostal space, left side of the chest, are for your babies, sleeping babies. And you count it for 1 full minute because you can hear that sleeping baby, you can hear the heart and hear the breath sounds better. There are breath sounds on children that always sound gurgly and they sound like this ronchi, but you know, it's upper airway. So always make sure that we listen to the upper airway to make sure that the lower airway is clear and it's not that upper airway making that sound. Car seats must be infants rear facing, rear seat in the middle for the first 2 years of life. After 2 years or 30 pounds, we can turn them around. The thing with car seats, make sure those shoulder straps are tight and snug. You also, with smaller kids, roll up blankets and tuck them in so that they're in there and they're tight in there, okay? And no, car seats do expire. So, infant, do you know what a head lag means? A head lag is when you have a baby on their back and you pick them up by their hands, and when they're younger, their head falls back. That's called a head lag. As we get older, the head comes up when you pull the hands with it. If we see a head lag after 4 months, there's something going on neurologically, and we need to check it. Remember, babies should be on back to go to sleep on their backs. They can roll from their abdomen to their back to their abdomen completely by 6 months old. They put their feet in their mouth when they're on their back. They love it. They can grasp objects about 3 months. They can put them hand to hand about 7 months. They can start teeth at 6 months. It doesn't mean they all get it. Some do, some don't. And they can stand up about 9 months old. Sitting unsupported 8 months. It's always been one that asks somewhere on every exam. And we know they're attempting or they're walking by 12 months. Colic is a lot of gas, and it usually goes away about 3 to 4 months. And it happens to everybody. There's no rhyme or reason with it. It doesn't matter burping them, changing formula. It's just what it is. The one thing about colic is sometimes we'll get phone calls saying that, hey, your this baby's been crying, my baby, he's been crying and crying and crying. I don't know what to do. And, what can I give him? Never ever think that it's only colic. This is any baby with abdominal pain really needs to be seen by a physician because it could be something really bad. Now you can get them. So there are different trends, and these are just definitions, so that you're just going to need to have to know those. Okay. Fontanelles, soft spots. You have the anterior up here, posterior in the back. The one on the top should close between 1 and 1.5 years old. If it's still open at 24 months, 3 months, 36 months, there's a problem. We will investigate. Is it hydrocephalus? Is it a tumor? Why is that thing still open, that fontanelle? The one in the back should close somewhere between 6 to 8 weeks. Usually it's gone before we even really start looking for it. But we do. That fontanelle, I look at fluid balance and everything with it. I love it. Pain. What do you see in pain? What do babies do? That little chin, when it starts quivering, it just hurts my soul. Crying, grimaces, chin, eyes closed. These are things that we will see. Remember, with children, infants, and if they're in pain, make sure that we're evaluating properly. Remember the pain scales. You're going to see them. From 0 to 3 is FLAC and nonverbal children. From 3 until they're adults, if you want, there are going to be on the FACES scale. Yes, you can use a numeric at 8, but you can use the FACES forever if you really wanted to. Infants, one of the best ways to solve pain is that pacifier with a little bit of sucrose, a little bit of sugar on it. We do, and we use that for infants with pain when we're starting IVs, drawing labs, doing a catheterization, urinary cath. And I'm telling you, it calms them and keeps them calm. SIDS death, the first 1 year of life, from birth to 1 year old, it is babies who are placed on their abdomens or sides at higher risk. Any loose beddings, those cute little bumper pads that I used to have for my kids. Nope, because they were hanging themselves on it. They even took the bed rails and made them smaller in between because kids' heads were going out and they were falling between them and literally hanging with the rails on the beds. No bed sharing. I've seen a man turn over and suffocate his baby. So no bed sharing, don't overheat them. Smoking is always going to be a big deal, whether it is saying that for SIDS death, prevention of otitis media, no smoking around children. And a recent viral infection. Why would a viral infection? Well, think about infants, ages birth to 1 year old. They are obligatory nose breathers. And they remember they had just learned how to suck, swallow, and breathe. Now you give them a little viral infection, they got mucus in their nose. They can't breathe that well. So that's why viral infections have increased SIDS death. And then, of course, premature formula-fed babies are at increased risk for SIDS. And if you breastfeed, you've decreased the risk for SIDS and male infants also. There are a couple of reflexes with infants. The Morrow or startle reflex. They hear a loud noise or you bang the crib, they go, and their legs and their feet come up like that. Normal. These disappear somewhere about 9 months. Then we have the grasp that, first is the reflex grasp and then the voluntary. And then we get the rooting. which is you take your little finger and you stroke the cheek, and they're going to move towards it. They're looking for breast or they're looking for their bottle. The parachute reflex is when you turn them over to put them in the crib and their hands and feet come up to protect themselves. Somewhere about 6 to 9 months that shows up. And guys, I think we know infants and nutrition. I think we're good for today. How about you all? It's Friday. You guys have had it. You can pick up my review from that point. Guys, good luck to you. Remember to come a little bit early next week for the exam. Anybody who needs extra tutoring for the exam, please make an appointment. I'm here. I want everybody to do as best as they can. Okay? There is a practice exam up there. Fortis 1 is the code. Please, if there's a problem with the exam during that day and you've done that practice exam, you're covered. Okay, so make sure you do those practices. There's for many reasons, but your protection. That's why I've had it up since last week. So Fortis 1, it's there for you. Goodbye,
Thank you.
guys.
Bye.
Have a great weekend.